starting the star grass. Hey everyone, welcome to the episode 1 of series Menorrhagia, where we will discuss one medicine for menorrhagia or any female symptom in details and compare it with the related symptoms of the other remedies. So before we get started, please note a very important thing that during case taking of a patient of menorrhagia, you should inquire about the presenting complaint very much, and you should give a very vital weightage to that, like the character of the blood, whether clots are there or clots are not there, the color of the blood, what is the color, whether it's fresh blood, whether it's bright red in color, whether it's dark in color, whatever it is that you should take care of. The duration of the blood menses, the duration of the bleeding, you should take care of. Whether leukorrhea is present before and after menses, that you should take care of. Also, you should see whether there is any associated symptom before or after or during menses or not. Okay, now let us move on to the next slide. That is the main medicine today, that is aletris farinosa. So as you can see in the image of a star grass, which many of us have noticed in our aquarium. So this is a plant from where the medicine is prepared. The tincture of the roots are used. This is the source of the plant. Now see the character of the blood. Black clouds, heavy and full of weight. Please note a very important thing, that is the uterus in a patient of aletris farinosa is very sensitive. The uterus is very heavy, very sensitive uterus. Along with that, this is the character of blood. There is marked anemia. Why is this? Because of profuse bleeding. There is marked anemia, due to which there is fainting with vertigo. This is important to note. Another very important associated symptom of aletris farinosa, without which you cannot prescribe the medicine, is debility and weakness, which is very important. The patient feels tired all the time. This is a very important associated symptom of aletris farinosa. Now, why is this happening? This is happening because of excessive bleeding. There is copious menses followed by watery oozing of blood between periods. There is premature and profuse menses associated with labor-like pain. There is contraction of the uterus. As I told you, the uterus is very sensitive, and there is an anemic and relaxed condition of the female organs, which is portrayed in this remedy. Now, let us see a few very associated symptoms with aletris farinosa. Now, before that, I would like to say one more point which I missed, is that as I was talking about in the beginning of the slide, that there is some associated symptom which you should take care of. So, in this case, you may get one symptom, cough during menses. This may be there in aletris farinosa, not in all the cases, but if you get it cough during menstruation, then this is a very strong indication for aletris farinosa. One more symptom that you should take care of is a symptom of the head. The patient will tell that there is a typical kind of headache, there is a typical kind of heaviness in the vertex and occiput, which is typically addition of symptoms, or this is a strong indication along with the other symptoms, the menses symptom and the weakness, debility, tired all the time, and all these things. So aletris is a very important female remedy. Now see crocus. Dysmenorrhea, flow black, stringy, clotted. So clotted blood was there in our medicine also. Clotted blood is there in crocus also. Now the character is black, stringy, like long strings. Okay, dysmenorrhea, painful menstruation. Coming to the next one, that is platina. There is blood flowing in dark clots and fluid. Then what is the character? Thick, black, tarry, or in a grumous mass. Like, mass will be there. Clots in many mass will be there. Like that, the character of bleeding will be there. Next is menorrhagia. If there is any staining in a patient of menorrhagia, then that stain of menses will be very difficult to wash. One more medicine which is having similar symptom is MAC-CARB. In MAC-CARB, if you see the character of the blood, it is acrid, dark, pitch-like, which is very important. And this is how, just on the base of the character of the menses, you can differentiate menorrhagia and MAC-CARB. Of course, totality of symptoms are there, all other characteristic symptoms are there, but if you have to differentiate between that one point of menses, the one character of menses. This can be a very useful symptom. The acrid nature of Macarb and the dark pitch-like character is not that much in Menorrhagia. It is a very characteristic feature of Macarb only. Otherwise, stain difficult to wash, it is there in both the medicines. Now, what is this dark pitch like? If you have seen roads are being made, in Hindi you call that alcatra. Okay, so that the character of blood, it looks like that. Okay, coming to the next one, lac caninum. Please don't forget about lac caninum also. Flow in gushes in bright red blood, viscid and stringy in nature. So long we are seeing the character of the blood was black, it was clotted. But in lac caninum, you will find fresh blood. And it is not clotted, but it is also stringy. It is not clotted, but it is also stringy. Now, a medicine that must be discussed. Eustalago maidens. Vicarious menstruation is there. Now, what all other medicines are there in our materia medica, especially in ALN, if you can say, which are also having vicarious menstruation. One is Bryonia, one is Phosphorus, and the other is Hamamelis. Many these other prominent remedies which you can instantly think of. Now, see the character of ovaries here. They are swollen, they burn, and they are very painful in nature. Especially if you see, in case of Eustalago, there is endometrial hypertrophy. Uterus is hypertrophy. There is endometrial hypertrophy in a patient who is going to approach menopause, or she is already approaching menopause, 45, 46 years old patient. She is coming with abnormal menstrual bleeding, heavy menstrual bleeding. There is profuse hemorrhage. You see there is endometrial hypertrophy. There is no other organic cause, and there is a flabby condition of uterus, which is nothing but hypertrophy, due to which the bleeding is occurring. And the character of the blood, you see dark clotted blood which is forming long strings. That is a condition where you can definitely prescribe Eustalago. Okay, so this is for a patient who is approaching menopause, more effective, but definitely you can use it for the other people also, other patients also who are in their middle age, like 30 to 40 years. Okay, but the character of the menses is very important, and endometrial hypertrophy is a cause which is also very important. Next is the leukorrhea of this medicine. So as I was telling, although the name of the series is Menorrhagia, but whenever you are discussing any female remedy, if that female remedy has symptoms of leukorrhea, symptoms of prolapse, and symptoms of other thing like abortion and all, that should also be discussed within this series. Okay, so see the leukorrhea. Leukorrhea is also occurring due to anemia, due to that profuse loss of blood, due to that profuse bleeding, due to that profuse prostration. The patient is developing debility, the patient is developing weakness, and also the patient is developing leukorrhea. The color of the blood, the leukorrhea, the discharge is white, and please remember the character here of the leukorrhea is stringy, like stringy leukorrhea. So far in the previous slide we have seen the stringy menses, stringy character of menses. So we have discussed crocus there, we have discussed lac caninum there, we have discussed platina there. Okay, here we will be discussing two important medicine which come in the differential diagnosis of stringy leukorrhea, or comparison of stringy leukorrhea. One is hydrostis, which we should never forget, and the other remedy that you should mention is calibicromium. So first is hydrostis leukorrhea, ropey, thick, viscid, yellow hanging from os in long strings. Remember this character of leukorrhea in hydrostis. Now see what is happening in calibi. In calibi, not only leukorrhea but any other, there is stringy discharge from mucous surface which adheres to the part, which sticks to the part, and from there it can be drawn into long strings. So that is a character of calibi. And since we are discussing the ropey or the stringy character of leucorrhea here, so I am not bringing other medicines like Marksol, like Bovista, and all the crocus is previously discussed. But here we are just willing to focus on the symptoms of leucorrhea, that is hydrosis and Cali bile. Okay. Now, after discussing the leukorrhea and the menorrhagia or the heavy menstrual bleeding, two more important symptoms are there. Otherwise, we can't complete aletris farinosa. One of them is abortion, habitual abortion. So due to this constitution, this debility, this anemia, this prostrated condition of the patient, this flax, relax, anemic prostrated condition of the patient, there is habitual abortion. And also, it's a very good medicine for prolapse, uterine prolapse. There is a tendency for uterine prolapse, like there is a tendency of abortion, there is a tendency of uterine prolapse, even rectal prolapse as well, pain in the right inguinal region due to uterine prolapse. So this is a very important medicine. And uterus, and again I'm telling you, it's very sensitive in this patient. Uterus is very heavy, very sensitive uterus these patients have. Okay, so that's it for today. Next Tuesday, I'll come up with another medicine for menorrhagia and I'll discuss the related symptoms. So, thank you. Till then, please do like, share, and subscribe my channel. Thank you. Bye.